Hello again after the record, and today, as you can see, we are going to discuss recall cases from antenatal care
And this
and
is an
from the
information
maternal
gathering,
medicine.
and just we have to do the whole case or just information gathering.
No, today is the whole case, my dear. Okay,
Okay, okay.
so take your time, Dr. Rega, and once you are
I'll
ready,
take my
please.
2 minutes. Yes. Okay.
Yes, your 2 minutes is going to start. It started already, okay? When you are ready, let me know so I can fix the timer for the 10 minutes. I always advise, my way, my friends, I always advise that you practice only within the frame of the 10 minutes, no more than that. Okay, so simply your mind will know what is the 10 minutes. Okay, so your brain is very smart and is going to get this sense of the 10 minutes. But if you are presenting one time at 11 minutes, one case at 14 minutes, and so on, you will never learn time management for this exam. And your brain will be confused simply. Okay, so.
Okay, ma'am. I will start.
Okay, your timer started.
Hello, I'm Dr. Rekha in the antenatal clinic. May I confirm your name and age, please?
Hello, doctor. This is Anne Miller, and I am 40 years.
How may I address you?
Anne is fine.
And how are you doing today?
I'm a bit worried, doctor, because somebody called me from the hospital and they told me that I have to see the doctor because there is concerns about my test result.
I can see that you are worried. We as a team are here to help and support you. Do you mind, Anne, if I gather a few details from you and then we discuss the results and further management plan together?
Yeah, sure, doctor. It's fine.
Can you tell me more about your pregnancy?
Um, yeah, this is my first time to be pregnant. I have some morning sickness sometimes. Sometimes I vomit, but it's okay. I think nowadays it's more better.
Okay. And it's your natural pregnancy, a planned one?
Yes, doctor. Yeah, I have recently married and I got pregnant in 2 months.
Okay. And apart from this, any pain, bleeding?
No, nothing at all.
Have you received folic acid?
Yeah. I take the folic acid. My midwife gave it to me.
Okay. When was the last period?
It's around 12 weeks ago.
Okay. Were your periods regular?
Yeah.
Okay. And any health issues for which you're following your GP, like diabetes, hypertension?
No, nothing at all.
Okay. And any operation in the tummy and down below?
No.
Okay. Do you smoke?
No.
Drink alcohol?
Not while I'm pregnant.
Okay, that's good. And pardon cross any recreational drugs?
No, never did.
Any family history of genetic problems?
Genetic problem?
A genetic condition? Any abnormal babies?
No. No.
Okay.
Why you
Any
say
person
that?
family history of clots?
No.
Any allergies that you are aware of?
No.
Your
No.
blood group?
It's A positive.
Okay. And what are you doing for your living?
I'm a teacher.
Do you have enough support?
Yes, of course. I'm married happily.
Nice. And do you feel down, depressed in last month?
No.
Okay.
I just become worried after this phone call yesterday.
Don't worry, I will discuss in a moment. And are you aware of weight to height ratio?
Yeah, I think it's 23.
Okay. And thank you for sharing your all these information. Anything else important you want to add?
No, nothing, doctor. I'm fine.
And have you started aspirin?
Aspirin? No.
Okay. We will start it you for the reducing the risk of high blood pressure and proteins in the urine. Okay.
Do I have a risk for blood pressure?
Yes, because when the woman is first time pregnant and her age is 40 years, it can increase the risk of high blood pressure proteins in the urine.
Okay.
Okay.
So,
So,
doctor,
and yes,
what is the problem in my test result? Please tell me because
yes,
I'm.
I'm coming to that. So, do you have any idea about your reports?
No, they just told me that you are high risk or your
Mhm.
baby is high risk or something. So I need to understand really.
Yes, I'm coming to that. So, do you want to involve someone during our discussion because I have to give you a lot of information?
No, I'm fine.
And after confirming your name and NHS number, generally we are offering the screening test to all the pregnant women, regardless of their age, to find out the woman who is at the high risk of developing the Down syndrome. And I'm sorry to tell you that your screening was done, which shows that it is high risk 1 in 100, which means that if we take the 100 women at the same age and time period.
Sorry. What you said now? Just said now. Would you please repeat that for me? You told me my risk is what
Yes,
in
yes,
yeah,
your
yeah. What is the meaning of that?
Yeah, I'm explaining that. Your screening report shows 1 in 100. It means that if we take the 100 women, one baby will have the Down syndrome, 99 baby will not have the Down syndrome.
So what did that mean to me? That mean that my baby um in a high risk of having this? You said that it's 1 in 100, and I can see that 1 in 100 is not very much risk. So why you're telling that this is a high risk?
Yes, at this actually we take the consider to be the high risk when there is 1 in 100. But let me tell you, Anne, that it is not a confirmatory test. It's just give us the tells us the chance of having the baby Down syndrome. It does not give us the definite answer of yes or no.
Okay.
Okay. So, and from now onwards, what we can do, we have the three options. Either we do nothing and we do another screening test, which is more accurate, and another is the confirmatory test in the form of needle test.
Okay.
Okay. So, do you have any preference, or may I
I
explain
want
you?
to know about this test. So
Okay.
you said it's not a confirmatory, so you need to confirm. I
Yes.
need to. Ah,
So, may I know that do you have any idea about the Down syndrome?
yes, I work with the children with the Down syndrome, and I know more about them. Yes.
Okay, that's fine. So we confirm the test by means of the needle test. As you are currently 12 weeks, it will be done by the needle test by taking the sample of the afterbirth in the fetal medicine unit by the specialist doctor after your consent under the ultrasound guidance. This we send to the laboratory for the confirmation of the genetic makeup. Am I clear till that point?
Yeah, yeah.
Okay. And after this test, there is a possibility of the having the miscarriage in 1 in 200, despite taking all the precautions.
Miscarriage. So you know that my age is 40, and I
Mhm.
was, worried about whether I would be able to carry a baby or not. So I was lucky to get pregnant as soon as I got
Yeah.
married. So for me, I don't think that I can afford this risk. No, I will not accept this risk.
Okay, so and your concerns are valid, but we as a doctor we have to tell you all the facts. Regarding another test is a blood test which is more accurate. That is NIPT. Do you want to know more about that?
Yes, please, yeah. What it
It is a
is.
blood test which we will take from you, and we know the genetic makeup of the baby. It is 99% accurate, but is 1 in 200. It can give the inconclusive result. So it is an not an diagnostic test. It's just tell us the that either it is high risk or not.
Yeah.
Okay. So also, as you are 12 weeks, we will do at the 20 weeks detail scan of the baby to see the markers for the Down syndrome. Either there is any heart problems or gut problems, or at that time, this will be done in the fetal medicine unit. Detail scan will be done. And again, you can reconsider the option if you wish. We will sit together. But whatever you wish, we are going to help and support you.
So you said that markers for the Down syndrome. What is the meaning of markers?
Marker means sometimes because the Down syndrome babies have the problems with the gut, the heart problems, and the limbs problems.
You know, doctor, I just wonder, um, why a baby can get a Down syndrome. There's nobody in my family have this. Nobody also in my partner family had this problem. So why this has happened?
And basically, what happened with the increasing age, the Down syndrome chances increases.
And how
Not
does it
your fault,
happen?
basically.
Okay, so how does it happen?
It happens because of the many reason, and so basically the age is the main factor. With the when the woman's age increases, the Down syndrome chances increases, and it because happens because when there is an extra copy of the chromosome, that is the thread-like structure at the chromosome 21. Because of this extra copy, the baby is having these issues.
Okay, yeah, okay, I can see.
And also at the 22 weeks, we do the detailed heart scan, and from the 26 weeks onward, frequent growth scans will be done for your baby. And during this time period, entire team will be there to supporting you, my consultant, specialist nurse, fetal medicine unit. I will also arrange the appointment with the baby doctor, who will going to explain you about the outcomes of the baby.
Oh, time. Thank you very much.
Okay, thank you.
Okay, thank you very much, my dear. So, Dr. Rika, what do you think about your performance?
Uh, maybe my patient is not satisfied with me. That's I feel like that.
Okay, so you can, when you give me a feedback or you
Hmm.
give a feedback to anybody, it's a part of your teaching, skills. You have to start with the things that were good first. So, what do you think you have done well in this station?
You can better comment there.
Okay, so I can see that time management was okay. A little bit, of few minutes were, sorry, few seconds were required, but it was okay. Also, the first part of the information gathering was fine, right? You managed to finish it in the time within 3 minutes and maybe half, something like that. So it was fine. Okay. Regarding the information that you told her about the Down syndrome, that's why the role player needed to, ask you at the end, and she repeated the question again and again. I hope that you get why she repeated the question. She repeated the question because she want to guide you to take the mark,
Hmm.
She she wants to help you because you didn't give um explanation of what is the Down syndrome. You said about the manifestation, okay, of Down syndrome, but you didn't say why it happened from the first place, because the explanation of any condition, by the way, is mandatory in the exam. So if a woman, for example, she had phenylketonuria, you have to explain what it is. If
Ma'am,
a
I
woman,
mentioned, I asked that do you have any idea about the Down syndrome? So you mentioned I work with them, so I
she,
have I.
yeah, I have children, but she is asking you why this has happened.
I
Why does
okay.
this happen? So she knows what is the Down syndrome. Everybody knows Down
Hmm.
syndrome, but they don't understand why the Down syndrome happened. It's part of your test, okay?
Okay.
Testing you for the explanation of the conditions, right? So if you have a patient, for example, and she got the preeclampsia, you have to explain to her what is the preeclampsia in simple words,
Hmm.
right?
Yes, ma'am.
Right. Okay. So simply, you can say that the Down syndrome is a genetic condition. You have explained at the end. I didn't say that you didn't, but on time, in the second part of your station, in your planning, whenever you have a condition, please offer the patient a layman explanation or layman term for the explanation of what is this condition. Simply, okay? You
Yes,
don't
ma'am.
need to speak more about the details. So the Down syndrome, as you said, it's a genetic condition. This is caused by the presence of an extra set of chromosome in the baby cell, right?
Hmm.
So
Yes.
what are the chromosomes? The chromosomes are tiny particles which are present in every cell uh, in our body, okay?
Hmm.
So most of the people, okay, will have the 2 copies of all chromosome. But people who have the Down syndrome, they have 3 copies of the chromosome 21. Okay, so
Okay.
this is the explanation, because sometimes in the exam he will give you Edward syndrome, okay, for example, or Patau syndrome. So you have to explain what is the difference here, right? Of
Yes,
course,
ma'am.
there is a difference between for example, Edward syndrome and the the Down syndrome, because babies with the Edward syndrome will have more problems in the, in the structure abnormality more than the people on Down. And people with the Down syndrome, they have, different presentations, of the Down syndrome. They are not the same. Some of them will have only mild learning disabilities or learning difficulties, okay?
Hmm.
And
Hmm.
some of them will have both, you know, uh, problems in development, and also some inner organs will be affected, So you need to tell her something like that, because the case in the exam when she came, she asked about the effect of the Down syndrome, okay? Because she was a little bit of, if this baby, I can't take care of this baby, what shall I do? Okay, so she need to know more about the information of the Down syndrome. So part of your explanation, please give more about what is the Down syndrome, how does the Down syndrome happen, how it occur, the simple explanation of the 2 lines that we said, okay, that it's a genetic condition caused by the presence of an extra chromosome in the body, and the chromosomes, they are the tiny particles which are present in every cell in our body, and most people will have 2 copies of the chromosomes. Avoid saying normal people, okay? Say just most people have 2 copies of the chromosomes, but people with Down syndrome have 3 copies of the chromosome 21, okay? So the examiner will give you a mark for this. That's why the role player insists on that.
Yes.
Effect or the implication of the Down syndrome,
Hmm.
okay, that can vary, okay, in between. Some can have a mild manifestation in the form of mild learning difficulties. Some
Hmm.
may have more complex problems in the form of both development and at the level of the internal organ formation. Okay, so this is what you need to say about the Down syndrome. Okay, dear?
Dr. Abba, so when I mean to say, what's a better question to ask from the patient? That I asked that, do you have any idea? So she mentioned. So I thought that she already know about that. Maybe
No,
I realized myself like
you
that.
told her, look, my dear,
Hmm.
if somebody asked you about what molar pregnancy,
Hmm.
okay? So
Yes.
she might heard about the molar pregnancy, but she doesn't know how the molar pregnancy is formed. It's a part of your exam. Remember,
Okay, I get your
it's
point.
an exam. They are testing your knowledge, but in a scenario like you are in a patient, like you are in a real clinic. So simply do whatever they want to hear from you. Okay. And if you didn't offer explanation of the condition, you will find that the role player asking you again. That's why people who repeat the exam, they have some question marks. Okay. They said, they used to say, I said everything. I told the role player everything, but she keep on asking something. That's mean if the
That
role
means that
player
they are not able
keep
to
on
answer.
asking something that she want more information about this part.
I got your point.
Okay. That's
Okay.
it. Okay, dear?
Clear,
Okay, so
ma'am.
otherwise you did well, okay, in the station. As I told you, it was good point regarding the information gathering, that it was concise. However, you can even make it, more simple than that, but it's fine. then you have to go to the second part, which is the explanation of the Down syndrome and what to do now. Okay, so what is the next level or the next step in our management? You offered her the correct one, okay, which is you have to have the confirmatory test, or if she is not happy or not okay with the confirmatory test, there is another screening test, and you should say what is the risk, like risk of miscarriage in the amniocentesis. You told her the needle test, it was correct. You have also to tell her how accurate is the screening test result.
I mentioned 99% and 92%.
Yes, correct. Yes, you did. Yes, exactly. Okay, so it was a good thing from you, because if you didn't say it, again, the role player will ask you exactly about those numbers and percentage. So it was good. I say that you have offered the correct management for the patient, right? And closing the station by saying that you're going to provide patient information leaflet, that you can also arrange another appointment with the consultant or with the pediatrician to know more about the implication of the Down syndrome. So it was fine.
Okay.
Okay, Dee?
Yeah, ma'am. Ma'am, like I didn't get the time of mentioning the written information. Should we say in the when we are making the agenda that I will give you written information right back to the GP? Is it a
Look, my
right
dear.
way?
Look, my dear. Okay. If you know how the station will end up with, okay, say that.
Okay. Okay.
That's it. So if you know, for me, I will always have some doubts about how this station will go, right? Because patient information about what you have to mention, by the way. Okay, I will give you more information or written information about the Down syndrome. Let's say patient asked you for termination. Then in this time, you have to tell her about termination, right? So we never know 100% how the station will go,
Will go.
because the college know that we know, and that we are here now practicing the recalls of the college. Okay, they are aware of that. So what they trying to do to test the competent candidate from people who are not very much competent. So they, twist a little bit in the scenarios. So when they twist in the scenario, you should be ready. Katie?
Okay, ma'am. Thank you.
You are welcome, my dear. Hello, Dr. Sarah. Dr. Sarah, she had a question. Shall we talk about the fertility? Right? She asked about concern. No, look, my dear, when you see that the main concern of the patient today is the Down syndrome screening, I will only take it to the Down syndrome screening, So like in the previous station, Dr. Reka, she speak about the aspirin, okay? Here is not the station when we discuss the risk of the preeclampsia. The whole theme of the station is the station about the Down syndrome, okay? And the patient need to hear more about the Down syndrome. She doesn't need to hear about other things, okay? So what will happen if I start speaking about fertility problem in the station? Her fertility or the reduced fertility or fertility options or whatever in that station. Time will fly, right? You will try to get back the time, or you get back on track, okay, to discuss about the Down syndrome. And thank you very much. Time is over and you didn't complete what's required in the station. Okay, so focus always, guys. They will, there is some distractors comes in the scenario. Like a patient comes to you, okay, with urogynecology problem. Clearly, she had a urogynecology problem. She is on medication for hypertension. Okay, shall I here now ask her about how is the control of your hypertension? When was the last time you have visited your doctors? Would you please allow me to know more about the medication that you receive for the hypertension? Can I do that?
No, ma'am. It will waste your
I did
time.
that.
Not
Yes,
make the
I
sense
did that.
also.
That will affect my time, and I will never take mark. On the other hand, the opposite is true. They will simply take marks out from you because you were not focused in that scenario of that day. Okay, so Dr. Sarah, just focus on the main concern of the patient. That will help you so much in the exam, okay? Because in real life, we have patients, for example, a patient had a problem, okay, let's say with PCOS, okay, and she had positive history of surgery that she have done appendectomy, okay, 5 years ago. Shall I now go to the appendectomy problem? No, right? So I need to be focused, okay? So it's your turn, Dr. Sarah, my dear. So if you want to present the task, please come on.
Yes, doctor. Here.
Okay, so please
Okay.
take your 2 minutes, sorry, for reading. And I will start your timer once you're ready. Okay, so I think that you need to start, my dear.
Hello, I'm Dr. Sarah, the doctor in the clinic. May I confirm your name and age, please?
Hello, good morning. This is Sarah Jones, and I'm 35.
How would you like me to call you?
Sarah's fine.
So, Sarah, I understood that you are here because you are planning for pregnancy and you are diabetic on insulin. Am I right?
Yes, doctor, it's correct.
Okay. You also has done urine tests and you was found to have some protein in the urine. Am I right?
Yeah, yeah.
Okay. So, any other expectation from our meeting?
I just want to know, doctor, if I can, have a baby safely or not, and whether my baby will have diabetes as well or not.
Your concern is variable. I just need to ask you a couple of questions. Then I will tell you about our plan of management. By the end, I will give you some written information. I will do some referral and I will be answering all your concerns. Is it fine?
Yeah, sure.
Can you tell me, please, are you having any symptoms right now?
Symptoms of what? I'm sorry.
Any are you controlled in your diabetes? I mean, are you having any problem right now?
No, I don't have. I have diabetes since I was 9 years, and I used to it.
And you are taking insulin. Are you controlled?
Yeah, I think I'm okay. Yes.
Okay. And is have any recent admission for insulin problem or something for diabetes problem?
No, no.
And you are in regular follow-up with your doctor, right?
Yes, doctor. Yes, I'm okay.
Are you having any headache?
Headache? No, I don't have.
Okay. Any high blood pressure readings before?
No.
Okay. And when was your last menstrual period?
This was, I think, 10 days ago.
Okay. And is it regular?
Yes, it is.
Okay. And are you on a contraceptive right now?
No, because we are trying for a baby, so I stopped using any contraception.
Started folic already. Hello?
Hey, sorry, I didn't hear that.
Have you started folic already?
Folic, no,
Okay. And have you ever been pregnant?
no,
Okay. And any surgeries before?
no, I never had a surgery.
Any allergies?
No,
Okay. Any other medical condition?
no, I just only have diabetes.
Okay. Do you smoke?
No,
Drink alcohol?
occasionally.
Okay. And are you feel enough supported?
Yeah.
Do you do for living?
I'm a designer.
Okay. And are you aware of your body mass index?
Yeah, I think it's 20 maybe.
Okay. Thank you for sharing all this information with me. Now, coming to your concern, Sarah, I can see that this belongs to you. This is your name, hospital number, and date of birth. It shows that the results of your blood test during the last 3 months shows that your hemoglobin is not controlled, your sugar is not controlled. That means that if we are going to get pregnant in this way, there may be some risks of losing the baby. Okay.
Okay, so you got from the test that my sugar is not controlled.
Yeah. This.
However, I had this insulin pen with me. I take it on time. Okay, and I think I have no problem with the diabetes. So how would I know?
For that, I want to ask if you are have you joined a dietitian to help you to control your diabetes?
Not recently, but I got used to the diabetes lifestyle,
Okay. And are you taking your medication by time and dose?
Yeah, but to be honest, I don't follow the test for the sugar.
Okay. Can I know why?
Because I feel like I don't need to. I'm fine. I don't feel dizzy or something.
Oh,
And that's it.
okay. Sarah, I would like to tell you that being compliant to the treatment is going to help you a lot throughout the quality of your life, and also it's going to help you in having the baby and not having complication throughout, and also it's going to affect you and your baby health and growth throughout the pregnancy. Okay, so it's better to if you can take the drug and the treatment and its regular time, and if I can also connect you to a good dietitian who's going to help you, and also a good the diabetes doctor is going to help you in such a thing.
Okay, that would be great.
Okay, very good. And also, I'm having some concern because of the protein in your urine. It can happen because of some sort of infection. However, we need to regular check on your blood pressure, and also check. We have to put an eye on you before getting pregnant. Okay. So I would like to suggest that you are going to go for a reliable contraceptive up to when we do code control for your diabetes, and so you can go for that. Okay.
Okay, so you want me now to stay in a contraception?
Yes, please. I would like to connect you to a family specialist, a family planning specialist who's going to help you a lot. Also, for the folic, as you are having diabetes, it's better to start with the dose of 5 milligram. We are going to continue that up to the 12th week of pregnancy.
Yeah, so what is this folic?
This is a kind of vitamins it's going to be giving to you. It's going to help to protect the baby from having what we call neural tubal defect, the problems in the brain and the nervous system.
Oh,
Okay.
okay. So you want me now to have this folic, okay, and you want me to use a contraception, right? So when I can be pregnant?
We are going to check you regularly once your blood results shows that you are controlled. You can go to pregnancy. However, if you got pregnant, it's going to be considered as a high risk pregnancy, and you are going to be followed in the hospital in a consultant-led unit, during which a group of doctors are going to take care of you, including the dietitian, the diabetician, and my consultant, the gynecologist, and special nurse and special midwife are going to take care of you. Okay.
Okay.
Okay. And you are going to have frequent test, blood test, and the booking test in Down syndrome. And by 20 weeks, you are going to have detailed scan to check on the baby from head to toe. And also, you are going to be followed regularly from 26 weeks for the 4 weekly for the growth of the baby.
Okay, so do you think that the growth of my baby would be affected?
Yes, having diabetes can affect the growth of the baby. That's why you can we are going to put you on regular screen. Okay.
Okay, that would be useful.
Okay. Any other concern, Sarah?
No, I don't have any other concerns. I just wanted the answer. You told me that you will tell me about the answer of my question at the beginning.
Sarah, for this one, you are asking if you can get pregnant right now. With this high level of hemoglobin of sugar in your blood, this can affect the baby. However, getting pregnant in this way can cause you some risks, like losing the baby in the early pregnancy.
It's your timer, thank you. Thank you very much. That's your timer. Okay, so here I will ask you, Dr. Sarah, what do you think about this consultation?
I think it didn't go well, doctor. I'm not prepared, doctor, for the diabetes.
No problem. Okay, so regarding the exam technique, it's not about diabetes now, it's about the exam technique. So what do you think that could be better in the exam technique?
I think I didn't. I must give her the information one by one, right? I mean, I were not very organized in giving her the information.
Okay. How about answer the patient question? What do you think?
It's better to answer them by time, right?
Yes, it's a must. And it's, it's a very common mistake people do, that they will tell the patient, because I don't know why exactly. People are so keen to start on history taking, okay, and they miss that the role player asked them a question and they didn't answer the question. They just postpone the answer, right? And postponing answer, right, can be very dangerous. Like in your case now, what was the question from the role player? The role player, anybody guys who's attending, Can remember what is the question of the role player?
Actually, I forget, doctor.
Yes, I know that you are a human, you know. We are all human beings, so we forgot. قل من لا يسهو دكتور. So, anybody remember what were the questions of the role player? The role player asked about the safety of pregnancy and whether her baby is going to have diabetes or not. Right?
Yes.
So, how can I answer the patient concern at the beginning, okay? And in the same time, I don't miss my information gathering. I tell you, people feel that they are insecure a little bit. They feel that, no, I must go and ask questions, okay? Like I'm interviewing her. And then at the end, I will answer your question. No, it's not correct, okay? If the role player asks you a question, this is an exam question, right? So you have to answer this exam question. How to answer this exam question and you don't miss the arrangement of the station in your mind and the plan that you have made for this station. Simply, my friend, answer her a short answer. The answer that will make you take the mark now, okay, and then continue on your plan or your agenda for this station. Okay, how? I'll tell you. If the patient comes to me and she wants to know if is it safe, okay, to be pregnant or not, or can I become pregnant when I'm having diabetes? So the answer is simply that most of the people, okay, who have diabetes type 1 like you, okay, continue on their pregnancy safely and have a healthy babies. But the most important thing is that we optimize the diabetes and make sure it's under control before embarking on the pregnancy. I appreciate that you came to us today, okay? So we together can reach to a safe plan for you, okay, regarding your diabetes control and the time to become pregnant. During pregnancy also, you will be under our high-risk pregnancy clinic, okay? And your care will be under a special group of doctors. This is to prevent, trying to reduce risk or prevent the most of the problems that diabetes can cause. Okay, so here I just answered her by the introduction of the patient information leaflet. I reassured her at the beginning, okay, about the importance of blood sugar control before embarking on the pregnancy, right? So now my patient is ready. She trusts me. She trusts me that I am working now. I'm asking her these questions. I am giving her a plan to follow, okay? Because she wants to control my diabetes so I can have a safe pregnancy and healthy baby. This is what the patient will think of when you reassure her at the beginning with 2 lines or 3 lines, okay? But it will give you at least 3-4 marks. How? Number 1, you answered the patient question. So you had 1 mark for answering this patient question. Good. Secondly, you reassured the patient and you appreciate that she came to the clinic today. This is communication skill. If a lay examiner is sitting there, he will be so happy. He will give you mark, right? And about the safety, because part of understanding the plan of care that we offer to the patient is under the safety. So when the patient understand why we give her this advice, okay, the patient will most likely follow this. And this is under the patient safety. But if the patient didn't understand why you tell her to wait, or why you tell her some advices afterwards, okay, the patient will not be engaged with you in the safely, mutually agreed plan that we say, right? So this is the patient concern answered, and now the patient is with you on the plan. Secondly is Will my baby have diabetes type 1? What is the answer? The answer here is simple, one word. And instead of saying your concerns are valid and I'm going to answer them after I take questions or ask you some questions, I can just give her one word. Can the baby have diabetes? Any answer? Hello, can you hear me?
Yes, ma'am. There is a risk of diabetes to the baby also if the mother enters the uncontrolled sugars later in the life.
Okay, so diabetes itself is not a genetic condition, right? Right? So
Yes,
people
ma'am.
are not inheriting diabetes type 1, right?
Yes.
But there might be genetic tendency in the future, okay, along with environmental factors that might increase the risk of babies having diabetes. But she is asking a simple question, is my baby going to have diabetes like me? Okay, so diabetes type 1 is not a hereditary condition. It's not inherited disease. Do you know that it's a autosomal recessive or autosomal dominant? No, right? So reassure her. Okay, so reassuring her, it's no. Okay, but having maybe diabetes in the family, running the family, increase the risk in the future along with but we can prevent that by lifestyle, by a healthy lifestyle. That's it, right?
So Dr. Abba will simply say that no, it does not runs in the
Yeah,
family.
no is the answer. Yes, no is the answer.
Okay. Okay.
Yeah, right. It's a misconception from the patient. The patient didn't get this information. She's just afraid. So reassure her. Okay. So then please after that, continue, continue your answer as normal. Take her permission, right, to go for the history, right? And start asking her about the condition, control, and effect on the quality of life, but quickly, okay? So we know that one of the complications of diabetes, especially after 25 years of having diabetes, at this patient, she had 26 years of diabetes, that diabetes can cause nephropathy, diabetes can cause vasculopathy, diabetes can cause retinopathy, right? So if a patient starts to have protein in urine, right, that's mean that maybe this patient is developing diabetes nephropathy. So here, it's one of the indications, okay, that I will say that I have to refer you to a nephrology. However, if you remember, my friends, from the guideline, and allow me for 1 second to share it, the information from the guideline with you, from the diabetes in pregnancy, in the preconception, okay, part of the preconception investigation that's mandatory for anybody with a pre-existing diabetes in the preconception period is retinal assessment and renal function test.
Yes.
Yes, is it correct? Yes.
Yes, that's correct.
If the patient, yes, so if the patient came to me, okay, I have told her about the importance of the blood sugar control. Then then I have to put in my mind in the plan, okay, now I will go to the plan, okay, about the preconception planning, that what is the important things to be done. Of course, the control of the diabetes, right? Follow up the hemoglobin A1C every month, okay, till it reach to a safe level, and we have to mention what is a safe level, okay? So she is 8%, we have to bring this number below 6.5% or below 48 millimole per mole, right?
Right.
Referral to, you have to arrange renal function test and retinal assessment test, okay? So that means she will need to do those tests, and then if the test of the renal function came and they show that the renal functions are affected, what shall I do?
We refer to the nephrologist first.
Yes, of course, we have to refer to the nephrologist. So the part of the assessment of the patient is not only the blood sugar control, it's retinal and renal assessment And I will consider referring the woman with diabetes to a nephrologist before stopping contraception if the serum creatinine is 120 micromole per liter or more, or if the urinary albumin creatinine ratio is greater than 30, okay? Or before pregnancy, I can do the EGFR, and if it is less than 45, also ml per minute per 1.7 meter square, okay? So this is the mandatory things that required in the plan for this patient before pre-pregnancy, you know, before she embark on the pregnancy. So this patient, okay, need a different plan, Dr. Sarah, right? She need to understand the risk of diabetes. She need to be reassured that it's not an inherited condition to the risk to the baby. I need to take it as a chance to speak about the risk of diabetes in general, okay? And in any maternal medicine condition, we have to cover the risk of the condition and on the pregnancy, including both mother and baby, maternal and fetal risk, and risk of the pregnancy on the condition itself, if there is any. Okay, so in this case, my patient needs some reassurance. Clear? My patient needs some reassurance. And in the same time, I have also to be clear in the facts, okay? I have to be honest when I discuss with her the risk of the condition, right? So I need to mention something about the risk of diabetes in pregnancy, as you started to do that at the end, but you should do it in the second third of your counseling, okay? So a preconception counseling station consists of 3 parts, okay? The first part is the introduction and the history taking, right? And the introduction and history taking, if the patient started by question, try to give a short answer and then proceed to the next step. A little bit of organization to our history taking will be good, okay? And it will reflect on our time management and both our marks also in the exam. So we start by the current condition, then we go to the past obstetric history, if there is any other medical problems, drug, allergy, and BMI, then go to the general gynae. This is a preconception, so you have to ask about the regularity of period as you have done. If the patient is more than 25 years, we ask about the smears. Also, just one question, are you updated with your smears? And so on, continue, okay? Family history, and social habits like smoking, alcohol, recreational drugs, and the partner health. The second part of the preconception counseling is that you explore the condition. Why exploring the condition? Because she's here today because she's worried, right? So I have to give her the correct information about the diabetes in pregnancy, okay? So to organize it in your mind, you have to have effect of the diabetes on pregnancy, risk to both mother, fetus, okay? Effect on the pregnancy, on the disease, like if there is increased risk of hypertension, if there is renal disease, this will be increased risk of deterioration of function, and so on, okay? Increased requirement of the insulin itself during the pregnancy, and more monitoring, okay? And more control is needed during the pregnancy. Then finally, you have to offer the patient a management plan. And remember, for the management plan for any maternal medicine condition preconception, remember, okay, that we need to control, right, the condition or optimize the condition for a better outcome. We are going to work in a team, okay, along with her doctor. We advise lifestyle modification, reliable form of a contraception, drug review if there is any, to see if these medications are safe in pregnancy or not, and we offer the folic acid, right? And according to the condition, we offer the right dose, right? High dose for the high risk conditions like diabetes, sickle cell, or like epilepsy, for example. Okay, my friends?
Okay,
Is
Dr.
it clear?
Clear.
You are welcome, my dear. So other stations of the preconception that you can try and you can, work on that to improve your, your counseling skills is something like preconception counseling for other medical disease like renal disorders, important, like a patient with IBD, inflammatory bowel disease, especially if they are on teratogenic medications or something, right? This is, you need to practice this. Also, you can have something like systemic lupus, right? Patient with systemic lupus also, they might use some medication that can be dangerous, or they need some to stop some medication, some of them on methotrexate. Same also for rheumatoid arthritis. Okay, so just guys, practice those stations that need preconception counseling. Also, there is another form of the preconception counseling for another entity of disease, like the hereditary conditions. Hereditary condition, like, for example, cystic fibrosis. Okay, there is a station of the cystic fibrosis recently appear in the exam, like hemophilia, like von Willebrand disease, right? Like sickle cell disease, like thalassemia. So those conditions, because they have risk of inheritance, in the preconception counseling, we need to add some more information, okay, to the discussion with the patient, right? So, my friends, you have, as I told you, maybe now we have enumerated like 10 conditions. Please practice those conditions, okay, for the pre-pregnancy counseling. Okay, guys?
Dr. Rabba, in the preconception counseling, should we say the patient that with uncontrolled diabetes is a risk of the stillbirth also?
Yes,
We can say,
yes, you
we
need
can
to
say
understand. Yes, sure.
okay, fine.
When I explore the condition, my dear, I have to be clear and honest, but I don't have to scare the patient, okay?
Yeah,
So
the
I
patient.
will tell
Okay.
her about the risk, and in the same time, give her advice on how to work to reduce this risk together,
Okay, I
okay?
got you.
To avoid scaring the patient at all. Thank you very much, guys. I would like to ask you for a break and then come back, if you don't mind, after 5 to 10 minutes.
Yes, ma'am.
Thank you very much.